friends, welcome back to Health and Wellness. Today we are going to talk about COVID-19 and its symptoms and prevention. The WHO has declared COVID is a pandemic. A global coordinated effort is needed to stop the spread of the virus. It affects different people in different ways. Most infected people will develop mild to moderate illness and fever without hospitalization. The last pandemic reported in the world was H1N1 flu in 2009. Symptoms may appear 2 to 14 days after exposure to the virus. Most common symptoms are fever, dry cough, tiredness. Less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin. Serious symptoms are difficulty breathing, chest pain or pressure, loss of speech or movement. Prevention. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving the public place, after blowing your nose, coughing or sneezing, after handling your cloth face cover, after changing a diaper, after caring for someone sick, after touching animals or pets. Avoid touching your eyes, nose and mouth with unwashed hands. If soap and water are not available, use a hand sanitizer that contains at least 60% of alcohol. Hand washing remains the number one tip for preventing the spread of coronavirus. When soap and water are not available, the next best option is to use an alcohol-based sanitizer. Choose a sanitizer that contains between 60 to 95% of alcohol. Also, when you use hand sanitizer, make sure you do so the right way. Find the directions on the back of the bottle and follow the proper technique. Generally, apply the liquid to the palm of one hand, then rub it all over both hands until the sanitizer dries. This takes around 20 seconds. Be careful not to wipe the sanitizer off before it's dry. Doing that can make it not as effective in killing the germs. Mask. To prevent the transmission of the virus from people without symptoms, the Centers for Disease Control and Prevention is now recommending that everyone wears a face mask. The recommendation is for when you are in a public place where it's difficult to maintain a 6-foot distance from others. The recommendation is in addition to continued physical distancing and proper hygiene practices. Social distancing. Inside your home, avoid close contact with people who are sick. If possible, maintain 6 feet between the person who is sick and other household members. Outside your home, put 6 feet of distance between yourself and people who don't live in your household. Remember that some people without symptoms may able to spread the virus. Stay at least 6 feet, about 2 arms length, from each other people. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Clean and disinfect. Clean and disinfect frequently. If the surfaces are dirty, clean them. Use a detergent or soap and water prior to disinfection. Then use a household disinfectant. If you have a fever, cough or other symptoms, you might have COVID-19. Most people have mild illness and are able to recover at home. If you think you may have been exposed to COVID-19, contact your healthcare provider and keep track of your symptoms. If you have an emergency warning signs like trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. To get an emergency medical care immediately. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. The preventive measures are your first line of defense. The best way to protect yourself from COVID-19 is to practice a good hygiene and follow these simple precautions to reduce your chances of getting the infection. Stay home, stay safe, and save lives. Thank you.